This program is called Go Baby Go, and we have about 40 national and international sites. So what we're doing tonight is I've invited some faculty, grad students, and some undergraduate students to help modify about 6 ride-on cars to be donated to families and children.
It was, well, I think she's going to say it for you. She's about to clap. It was so amazing to see her take off and do something that a normal child would do.
Trying not to cry, really. It's thrilling considering my daughter, we weren't even sure she was going to make it. You know, this is thrilling that she's able to drive a car and go somewhere.
These are off-the-shelf cars, and we modify the activation switch so that we put a large button on the steering wheel. And the switch is unique because it's very easy to press and has a very large surface area for contact. So it's much easier to press for children with disabilities.
This is awesome, yeah, because she totally practices with switch buttons at home, and so having a switch on a car and being mobile for her is it's thrilling because she just can't be mobile without something like this.
The second thing that we do is we use PVC and we modify a seating support to provide them with some extra support that they need so that they can be safe while driving the car. And that also typically involves using pool fun noodles and also kickboards as well.
To me, it's so cool, and it's like exactly what I want to do because I want to work with kids with special needs, and I think helping them gain independence is so awesome. And so he asked us if we were interested, and I was like, sign me up.
When I was a master's student at the University of Delaware, I shared a gym much like this one with a PhD student in the lab of Cole Galloway, who founded this program. And what she was doing was showing that babies as young as 6 months old could learn how to drive joystick-driven robots. And as a result of this early power, they showed developmental gains in cognition, social, language, and motor, so really across all these different domains. The problem was there was only one available robot back in the lab that was a research tool. So there simply isn't anything commercially available for children birth to 3 to use as early power. We started doing national workshops across the country to teach clinicians and families how to build these cars. And at the end of those workshops, we always invite families to come, and just seeing these kids for the first time being able to control moving from one place to another on their own, just like typical peers are able to do on a daily basis, I was just hooked.
I think it's a really cool program. I mean, for her to have something while we're in limbo, going through the process, getting her a wheelchair to give her some mobility, keep up with her sisters, would be cool.
It was just absolutely amazing. I wish there was more programs out there like this to modify things for special needs children.
So one of the things that drew me here as faculty was the emphasis on public health, physical activity, and also a very strong emphasis in disability studies as well. And so those are all areas that the College of Public Health and Human Sciences really focuses on. And so I thought it was a really great fit for myself and the research that I do, but also very specifically this program. And it was just a great opportunity to bring it to the Northwest. What we see is an increase in being able to mobilize and move from one place to another, but also their social interactions also jumps up quite a bit as well. So we've actually had these not only in homes, but also in gymnasiums like this one, and also on playgrounds to not only move from one place to another, but also to use this newfound means of exploration to engage with peers.
She's got her older sisters that she gets frustrated, she'll cry because you can tell she wants to go do what they do and be able to go from room to room and run around outside and play, and she can't right now, but I mean, with this car, I'll definitely help that.
She is going to be able to chase her brother around down the street on his bike, and because that's something she has never been able to do. I mean, I can push her in her wheelchair behind him, but this is her on her own doing it by herself, and I think she's going to have a great time.
We've had children of all kinds in these cars before, including spina bifida, Down syndrome, cerebral palsy, even children with complex medical needs, such as having a trach tube for breathing and ventilator dependent. We're currently working with industry partners to try to convince them with our research that there is a need for their commercially available device that will really fill that gap, and so we're hopeful that will be happening soon.
I think this program is wonderful, and I just think you guys should keep doing it, and it's going to affect a lot of people in a lot of different ways, and it has touched us, definitely. I started tearing up when I first saw her go, so it was great.
So we hope that tonight really kicks off the local program for Oregon State, and that we're excited about where these future directions might go. We hope that the Ride on Cars is just one device of many to come from the university here.